Warning seniors. Over 60. This vitamin causes numbness. Fix it fast. If you're past 60 and you find yourself waking up in the middle of the night with your feet burning like crazy, or maybe you've got this weird sensation like tiny bugs are marching up and down your legs, then what I'm about to tell you might just change everything for you. Here's what happens way too often. Doctors immediately jump to diabetes testing and start writing prescriptions. But here's the thing, there's a single vitamin that's missing in nearly 40% of older adults, and it might actually be what's behind all that numbness and tingling you're dealing with. I'm Dr. James Caldwell, and today I'm going to show you the vitamin that even nerve specialists sometimes overlook. This is the one that could turn your symptoms around before you're stuck with nerve damage that can't be fixed. Stick around, because the next 15 minutes could spare you years of dealing with problems you don't have to live with. Before we get rolling, I'd really like to know where you're tuning in from and how old you are. Go ahead and drop your location and your age down in the comments. It really helps me get a sense of who I'm talking to and make sure I'm creating stuff that actually matters to you. Let's grow this community together. Let me kick things off by telling you about something I see happening in doctors' offices all over this country, day in and day out. I keep hearing the exact same complaints from the folks who come see me. They're telling me their feet are hurting so much that they literally can't stand having their bed sheets touch them when they're trying to sleep. Some of them describe feelings that sound almost impossible to believe, like something's biting the soles of their feet when there's absolutely nothing there. These aren't made-up problems. They're completely real. They're incredibly upsetting. And for a lot of people who've crossed 60, these are actually the very first clues that something significant is going on inside their body. Now here's what most folks have no idea about. Those feelings, the burning sensation, the tingling, that numbness, they're often the very first obvious indicator of something called peripheral neuropathy. I know, that sounds like some complicated doctor speak, but hang with me here because getting your head around this could literally change your life. Peripheral neuropathy is basically damage happening to the nerves that spread out from your brain and spine to everywhere else in your body. Think of these nerves like the electrical wiring running through your home. They're constantly carrying messages that let you know when something's scalding hot, freezing cold, or squeezing too tight. They're what tells your muscles it's time to get moving. They're even managing stuff you never consciously think about, like how your food gets digested or how your blood pressure stays regulated. When these nerves start breaking down, those messages get all mixed up or they stop going through completely. That's exactly when you begin experiencing those terrible feelings in your feet and your legs. For the majority of people, doctors instantly assume it's diabetes. And sure, diabetes absolutely is the top reason for peripheral neuropathy around the world. Roughly half of everyone living with diabetes is going to wind up with some kind of nerve damage. But here's what really surprised me when I dug into this subject. In about 1 out of every 4 neuropathy cases, doctors just can't pin down what's actually causing it. People get their diabetes checked. They get their thyroid function evaluated. They go through this whole lineup of pricey tests, and every single one comes back perfectly normal. All the while, their symptoms keep going, or they actually get even worse. This is where things get both fascinating and honestly kind of maddening. There's one straightforward, affordable blood test that frequently gets left out, and it's checking for something that might be responsible for every bit of what you're experiencing. I'm referring to vitamin B12. Now, before you start thinking this sounds way too basic to actually work, let me break down why this particular vitamin is so incredibly important, especially once we hit 60. Vitamin B12 has this absolutely vital job when it comes to keeping your nerves healthy. Picture it like the protective coating around those electrical wires in your nervous system. When you don't have enough B12, that coating starts falling apart. The messages can't get transmitted the way they should. That's when the tingling shows up, along with the numbness, the pain, and the weakness. The really concerning part is that B12 deficiency can trigger the identical symptoms you'd see with diabetic neuropathy. But it gets missed all the time. So why does this keep happening? Well, most doctors are taught to consider the most frequent causes right off the bat, and that's diabetes. They don't necessarily test B12 levels unless you bring it up yourself, or unless everything else they've tested has turned up nothing. Here's something that really got my attention. As the years go by, our bodies get worse and worse at soaking up vitamin B12. Some research suggests that as many as 20% of people over 60 are running low on B12, and a whole bunch of them have no clue. This happens because of a few different reasons. For starters, Our stomachs make less acid as we age, and we actually need that acid to pull B12 out of our food. On top of that, lots of seniors are on medications that mess with B12 absorption. Regular medications like metformin if you've got diabetes, proton pump inhibitors if you're dealing with heartburn, and even certain antibiotics can drain your B12 stores gradually over time. Then there's a third factor. Some folks have conditions like pernicious anemia where their system just can't soak up B12 the right way, no matter how much of it they're taking in. Let me walk you through how this usually plays out. You're somewhere in your 60 seconds or 70 seconds, and you notice your feet are feeling kind of numb or tingly, particularly when you're trying to fall asleep. Maybe you're struggling a bit with staying balanced. You bring it up to your doctor when you go in for your yearly visit. They order a fasting blood sugar and maybe an A1C to look for diabetes. Those results come back either borderline or totally normal. They tell you it's likely just what happens when you get older, or maybe they write you a prescription for pain medicine. Months pass, sometimes even a couple of years, and your symptoms are gradually getting more intense. What nobody ever checked was how much B12 you've got in your system. And this entire time, your nerves have been slowly breaking down because they're starving for the nutrients they absolutely have to have. Now, I need to make something really clear here. I'm not claiming that every single instance of leg numbness or neuropathy after you turn 60 is because of low B12. That would be reckless and just plain wrong. Diabetes, autoimmune problems, infections, specific medications, getting exposed to harmful substances, and even things passed down in your genes can all lead to neuropathy. What I'm telling you is that B12 deficiency is common, it's fixable, and it's frequently missed, and it really deserves more attention, particularly for those of us in the over 60 crowd. The encouraging part, and this is genuinely crucial, is that if you catch B12 deficiency early enough, you can often undo the nerve damage. I've watched this happen plenty of times with my own patients. When people show up with symptoms that are just starting and we find out their B12 is low, getting them on B12 supplements can halt things from getting worse and even repair some of what's been damaged. But here's what you've really got to understand. If you wait too long, if that nerve damage gets serious and becomes permanent, even fixing your B12 levels isn't going to bring your nerve function all the way back. That's exactly why catching this early is so absolutely critical. So what are the warning signs you should be watching for? Beyond the obvious numbness and tingling in your feet and legs, running low on B12 can create a whole bunch of symptoms you might never think are related to a vitamin issue. You could be feeling way more exhausted or weak than usual. You might realize you're getting winded a lot easier than before. Some people end up with a tongue that's sore or swollen. Others go through changes in their mood, like depression or memory issues that could get mistaken for the early stages of dementia. You might feel wobbly on your feet or have a hard time with your balance and coordination. Some folks talk about feeling like they're wearing invisible socks or gloves, even when their hands and feet are completely bare. Here's what makes this particularly challenging. A lot of times these symptoms creep up on you so slowly that you don't even register them at first. You get used to being a little more worn out. You attribute the balance problems to just getting up there in years. You don't piece together all these clues until all of a sudden you wake up and realize your quality of life has taken a serious nosedive. That's exactly why I'm so fired up about getting the word out on this. Way too many older adults are dealing with unnecessary suffering when a basic blood test and the right treatment could turn things around completely. Let's get into how you can actually get tested and what you should do if it turns out your B12 is running low. First thing, you've got to specifically ask your doctor to run a B12 blood test. Don't just assume it's already part of your standard blood work. A lot of times it's not included unless somebody asks for it directly. The test itself is straightforward, it doesn't cost much, and most insurance plans will cover it. Normal B12 levels are usually thought to be anything above 200 picograms per milliliter. But here's something really important that a lot of people aren't aware of. Some specialists think that levels sitting below 400 can still create symptoms in certain people, especially when we're talking about neurological problems. So even if your doctor tells you your number is technically in the normal range, if you're dealing with symptoms and your level is hanging out on the lower side of normal, it could be worth talking about treatment regardless. If it turns out your B12 is indeed low, treatment usually means either taking high-dose oral supplements or getting B12 shots. For folks who've got absorption issues going on, the injections tend to work better because they completely skip your digestive system. A lot of patients begin with shots every week or every month until their numbers get back to where they should be, and then they move to a maintenance schedule. Some people have to keep up with treatment for the long haul, especially if they've got an absorption problem that can't be corrected. The good thing is that B12 is water-soluble, which means whatever your body doesn't use just gets flushed out. That makes it really hard to overdo it. Now, let's talk about keeping this from happening in the first place, because prevention matters just as much as fixing the problem. You can lower your chances of ending up B12 deficient by making sure you're getting plenty of it through what you eat. Vitamin B12 exists naturally in animal-based foods like meat, poultry, fish, eggs, and dairy products. If you're eating vegetarian or vegan, you're at a higher risk and should definitely look into fortified foods or taking supplements. Even if you're eating tons of animal products, keep in mind that for a lot of seniors, absorption is the real problem. That's why some experts are saying that everyone past 50 should probably be taking a B12 supplement just to be on the safe side. I also want to tackle what nobody's saying out loud. Some of you are probably thinking, this all sounds way too simple. You might be doubtful that something as basic as a vitamin could be behind such major symptoms. I totally get that doubt. We're living in a time when medicine is incredibly advanced and technology is cutting edge. It almost seems too easy that a simple vitamin could be what you need. But that's precisely why deficiencies slip through the cracks. Doctors are trained to hunt for complicated problems, and sometimes the most straightforward answers get completely ignored. Let me fill you in on what else can trigger peripheral neuropathy, because you need to see the whole picture. Diabetes is still the #1 cause, affecting roughly half of everyone who has diabetes. If you're diabetic or pre-diabetic, keeping your blood sugar under control is absolutely essential. When your blood sugar stays high, it damages your nerves over time, and once that damage gets severe, there's often no going back. That's why identifying pre-diabetes early and making changes to your lifestyle can stop neuropathy before it ever gets started. Certain medications, particularly chemotherapy drugs, can cause nerve damage as an unwanted side effect. Some infections, including COVID-19, hepatitis, and Lyme disease, can set off neuropathy. Autoimmune conditions like lupus and rheumatoid arthritis can actually attack your nerves. Drinking too much alcohol is poisonous to your nerves, especially when you're not eating well on top of it. Getting exposed to toxins like mercury, lead, and arsenic can harm your nerves. And there are some rare inherited types of neuropathy that show up in certain families. In roughly 25% of cases, doctors aren't able to figure out exactly what's causing it, but a lot of these patients have things in common, like being overweight, having high cholesterol, and dealing with high blood pressure. The way damage happens underneath it all might be pretty similar to diabetes, even if there's no official diabetes diagnosis. This is why your overall metabolic health becomes so critical as you age. So what should you actually do if you're dealing with numbness, tingling, or pain in your legs? First off, don't brush it off. These symptoms are your body's way of waving a red flag that something's not right. Get an appointment scheduled with your doctor and be really specific about what you're going through. Let them know when the symptoms first showed up, how often you're experiencing them, whether they're getting more intense, and how they're messing with your everyday life. Make a point to ask for your B12 level to be tested, right along with diabetes, screening, thyroid checks, and whatever other relevant tests make sense. If you do wind up having neuropathy, partner with your doctor to figure out what's causing it and deal with that root issue. Get your blood sugar managed if diabetes is in the picture. Fix any vitamins you're running low on. Take a look at your medications to see if any of them might be part of the problem. Make shifts in how you're living, things like eating better food, moving your body regularly, staying away from alcohol and cigarettes, and keeping your weight in a healthy range. Every single one of these supports your nerve health. When it comes to foot neuropathy specifically, get yourself into a solid foot care routine. Look over your feet every day for any cuts, blisters, or sores. Wear shoes that are comfortable and fit you properly. Make regular visits to a podiatrist. Since neuropathy can reduce how much you can feel in your feet, you might not notice injuries that could end up infected. Staying ahead of it is everything. If you're struggling with neuropathy pain, work together with your doctor to figure out the right treatment approach. Not every medication is going to work for every person, so don't throw in the towel if what you try first doesn't do the trick. Physical therapy can build up your strength and improve your balance. Getting mental health support can help you handle living with chronic pain. It's completely okay to reach out for help and to keep searching until you land on what actually works for you. Here's what I want to leave you with today. What you're feeling matters. Your quality of life matters. You deserve real answers, and you deserve treatment that goes after the actual cause instead of just covering up the symptoms. Don't let anybody brush off what you're concerned about as just something that comes with getting older. Numbness, tingling, and pain in your legs aren't normal parts of aging. They're signals that something needs to be looked at. If there's just one thing you remember from this video, make it this. Ask your doctor to check your vitamin B12 level, especially if you're over 60 and you're experiencing any kind of neurological symptoms. It's a basic test that could uncover a simple fix for what might seem like a complicated and scary situation. When it's caught early, B12 deficiency and the nerve damage it creates can often be turned around completely. That's the kind of result we're all hoping for. I hope what I've shared here gives you the power to take control of your health and have real conversations with the people taking care of you. Always remember, you know your own body better than anybody else does. Trust what your gut is telling you. Stand up for yourself. And don't stop asking questions until you've got the answers you're looking for. If this video was useful to you, please hit that thumbs up button and pass it along to anyone you know who might be going through these symptoms. Subscribe to Dr. James Caldwell for more science-backed health information created specifically for those of us past 60. What's been your experience with leg numbness or low B12? Have you gotten your levels tested? Share your story down in the comments. I go through every single comment, and hearing what you've been through helps other people in our community know they're not alone. Stay strong, stay healthy, and I'll see you in the next video. If you found this video helpful, make sure to hit that like button. It really helps the channel. And don't forget to subscribe and turn on the notification bell so you never miss out on future videos. I'd love to hear your thoughts, so drop a comment below and let me know what you think. Thanks for watching, and I'll see you in the next.